So it really gives us that one-stop shop of seeing the bigger picture of the EMR instead of just each individual section.
What if a focus on safety could also improve efficiency and possibly save money for your practice? Despite the importance of patient safety, it's traditionally been thought of as something added on to practice operations, requiring additional effort and therefore expense to run reports and investigate workflows. Fortunately, eClinicalWorks includes the Safety and Compliance Dashboard as part of the base software included for all users. This dashboard automatically tracks over 210 key metrics that help to pinpoint issues before they become a drag on your operations. Now, here to share her insights on how the Safety and Compliance Dashboard is improving standards at Primary Health Center is Joy Kelly, EMR Specialist and Trainer. Joy, thanks for joining the eClinicalWorks podcast today.
Hey, Adam, thanks for having us. How are you?
Oh, I'm doing well, thank you. And so excited to talk with you. So, Joy, I have to ask, you are a trainer. That's your job role, your job title. How did you get roped into tracking safety and compliance?
So part of training is also part of safety and compliance. It actually goes together. It works hand in hand. It's one of those things where the EMR system is so important for safety and compliance that years ago you wouldn't see, but now you do. So we track different metrics in our EMR to help with our safety and compliance as well.
What's an example that comes to mind when you think of that?
So I can utilize the dashboard to tell me like if medications are failing. We had that issue previously. We had some prescriptions that weren't going through. It was an NDC issue that we weren't aware of that had changed. So once we figured that out, we could fix it. Our patients get their medication. They're not having to call the clinic back. The pharmacy's not calling saying, hey, we didn't get this. So it worked out better for us and the patient. And we wouldn't have known about it unless we had gotten a phone call from a patient.
So it sped up your time that it took between the problem occurring and your ability to understand and fix that. Sounds like you actually even got out in front of it before anybody had a chance to call with an issue.
Yes.
Uh,
So it's very helpful.
so Joy, I think a lot of practices don't even know that this dashboard exists. By the way, practices can go to their EMR menu and in the search bar, type in safety to find this dashboard. It'll come right up. How do you, Joy, use this tool?
So I actually have it set as my home screen. So as soon as I log into ECW, I actually see it every time. And it actually gives me all of the metrics to where I can actually see, what's the changes, what's variations, what's going on. So it puts it right in my face to where I know it's there so I can look through it.
Now, this dashboard, I know, recalculates all of the thresholds and the metrics every night, and it flags anything that's over the threshold. What do you do with that information once it's, as you said, right there in front of you?
So if there's ever a time where there's an issue, I can reach out to our clinic director, members of our admin, different management staff and say, hey, we have an issue going on. Can we look at this? Um, Maybe something is on our side. Maybe it's a training issue. Maybe it's an EMR issue. But it kind of gives us a heads up to look ahead.
Now, these metrics are also interactive, correct? So tell me about how you work with this data once it's presented to you on the dashboard.
So I can actually just go into the dashboard and click on the update and it'll update it in live time. If I need a report, I can click on EBO and it actually pulls my report up for me. So I'm not having to go into the EBO and build my report. It's so user friendly and it's right there in front of my face. So it's a time saver.
Excellent. I know it's also a drill down as well, so you can dig into more specific facilities or providers or different things like that, correct?
Yes, which is really good too, because then I can actually see a specific issue and where it's coming from and what we need to do to fix the problem.
I'm sure that's very handy when you're, the training specialist there, and you need to figure out who needs to be retrained or maybe where mapping needs to be redone. Now, the dashboard itself, I think, comes with a lot of automation. The safety and compliance dashboard auto populates the favorites, as it's called, with common KPIs that other customers are using. But what are some of the other key metrics that you are tracking?
So we track our telephone encounters. We have a specific time frame that our telephone encounters need to be closed, and the patient spoken to. So if we see, an increase or a decrease, we can kind of see, maybe we need to do some extra help in that area to get those cleared out. Um, we track our referral process. It's part of our FTCA. We have to be able to say we have a way of measuring how we are tracking our referrals. So that helps as well. Um, and then we use it for like medications failing to the pharmacies. So I can see if, we had an X amount of number of prescriptions failed. I can look at it and go back in and change it up and make sure that that patient got that medication.
Now, I think you mentioned also at one time that you're implementing some new AI tools, maybe the AI fax, in fact. How is this dashboard helping you to make sure that that goes smoothly?
So it actually shows the inbound fax. So if we have like a really low number, I can tell that it's not working correctly. So maybe we're not getting the fax in. I can reach out to eClinical and say, hey, I think something's hinky here. Can you help us with this? Um, so it actually saves time on, like a whole wasted day of faxes coming through. So we can actually monitor how many are coming in and how many AI is actually taking and putting where they need to go.
And I know that your organization is also a federally qualified health center, and that you serve a needy set of patients. How is this helping you to support them in better ways?
Because it actually gives us better access to know like a bigger picture. It's the broad spectrum of everything that's going on in our EMR. So our goal is to put our patients first. So if we are having issues with, say, referrals or say, not getting enough records coming in inbound to get, the patient's records, say they're coming in for a hospital follow-up, it helps me track that. Telephone encounters, if we have a high number of telephone encounters, why? What's going on? What are we not doing to help serve our patients? Um, so it really gives us that one-stop shop of seeing the bigger picture of the EMR instead of just each individual section.
I have to ask, Joy, where did you get this information before? I know you mentioned EBO earlier. How much effort did it take to get some of that information, and how much time have you been saving now that you're using this dashboard?
So it literally was previously I would sign into the EMR and literally go to each tab, each jelly bean and research to look to see what was going on. Um, or have to go to the EBO, or actually we have a data manager and she's our EBO expert. So I would call her and say, hey, can you help me? Can you pull this report for me? So she would have to, stop what she was doing, do that. So it literally is a time changer. It probably saves me 30 minutes to an hour, just from not having to delve deep into certain issues because it's right in front of my face.
Now, how do you get this information into other teams, right? No person is an island, and you're only one member of the team. How do you get this in front of the other people that need to know about this information?
So the report actually goes to the safety and compliant dashboard, actually sends a M Jelly Bean or quick launch button to message to all of our admin, including our providers are listed as admin. So they actually get it every day. So they can see it as well to see what the difference in the KPIs are. Um, they do actually look at it. And if they have questions, like they'll send a message, hey, what's this? What's this mean? Why is this here? Um, and then if I see anything that needs to be addressed, I can reach out to the proper staff and say, hey, can we look at this? I think something's going on here.
How do you think the dashboard has improved your users' trust in the EMR?
I think it is very accurate. I've never had anything come back on it that wasn't accurate. Um, and knowing that it's actually tracking the KPIs, which is something that all facilities seem to do, they have their set KPIs that they want to track to know what they're doing and how productive they are. So it's actually giving us a lead in being able to say, hey, this is what's going on. And it's on point every time. I've never had to go back and say, well, that wasn't right.
Thank you for taking the time to speak with us today and share your insights on how the safety and compliance dashboard has helped you out.
Yeah, absolutely no problem.
If you'd like to learn more about the topics we discussed here today, you can contact your strategic account manager or visit my.eclinicalworks.com. And don't forget to check out our other eClinicalWorks podcast episodes on YouTube, Apple Podcasts, Spotify. If you've also enjoyed this conversation, be sure to like and subscribe so that you're always up to date with the newest topics, and share these with other people that you think might get some information or some benefit out of them as well. We'd really appreciate it. For the eClinicalWorks podcast, I'm Adam Salati, and thanks for watching.